for examinations purpose, for MB, you know, like theory and practical, huh? So the topics in semester exams. All right, so these are important for some, like for example, say tuberculosis, MDR, XDR. Okay, then beta lactam, suppose cephalosporins, suppose morphine, opioids important है ना. So like opioids versus NSAIDs, this can be asked. If NSAIDs, acute gouty arthritis है ना. So more drugs like okay, arrhythmia, okay, angina, here the sublingual route in the short note. All right, arrhythmia. Then there is heart failure, new drugs, okay. The most important is hypertension. See, the common is commonest, so hypertension and type 2 diabetes mellitus. These are like long questions. Again, for example, you can see over here, TB, beta lactam you can leave, TB and morphine as a long question. You can prepare, right? Arrhythmia classification, again hypertension classification. Okay, there are many other things, like suppose in Parkinson, right? The drugs, the anticholinergic drugs here can be asked in the short note, right? There is a separate video for poisoning, all types of poisoning. Again, morphine poisoning, organophosphorus poisoning, right? So this is, I think, these topics are very, very important. There are many things in the theory which can be asked. The topics are important which are actually asked, right? Again, in the practical point of view, see, making a list is a difficult task, but again, suppose in prescription you may be asked about very common things, okay. Like suppose dysentery, amoebic dysentery or bacillary dysentery, right? So this very basic things, okay, which you will encounter in your day-to-day life, right? Suppose you'll get another like like pain abdomen, right? You can be given snake bite, okay. You can be given malaria, you can be given migraine, malaria, filaria, migraine. Typical, you can be asked like, what is the prescription for headache, what is the prescription for fever, what is the prescription for cough. This kind of normal simple prescriptions can be asked, right? We cannot say that okay, these things are out of syllabus, or this, how can you can ask these topics. But prescription, you should be ready with many other things, okay. Now sea snake bite, scorpion bite, है ना. So whatever you are going to encounter in your day-to-day life, so that will be asked in prescription. And after prescription, what are the things which you are extra telling to the person is the communication, है ना, in the communication. So again, in the dysentery, amoebic dysentery, bacillary dysentery, please, this bacillary dysentery is because of Shigella, and this is because of the entamoeba histolytica, है ना. So metronidazole here is given. Don't get confused that what to be used in where, right? Okay. So again, in the P drugs, suppose in the P drugs, someone was asking, sir, what can we write in like XDR TB as a P drug? Okay, so you should know about BPAL regimen, linezolid, bedaquinyl. You should know the name of the drugs, right? If you can classify the drugs, then I think this is very easy for you for all the classifications. If you know the P drugs can be written, all the classification can be you can write it down, right? Now suppose a prescription also, again very common, UTI, okay, then typhoid. So see, these are very, very common things which I think you have to know, okay. Then suppose in the P drug class also, again typhoid can come, again UTI can come, है. So these are common, the topics are common for both P drugs and prescription. You can be asked in any way or the other, है. Suppose in the prescription only or in the P drug only, you can be given this bronchial asthma, all classification of bronchial asthma, or you can be asked about status asthmaticus, which is known as acute severe asthma. This is also very common. Now suppose there is a mixed worm infection, है ना. Suppose there is kala jar. So what do you write in P drug for kala jar? What are the drugs when we given with the kala jar, right? So again, prescription and P drug can be interchanged or can be given anything, all right? You can be given any of the topics. Okay. Now I've said about angina, I have said about I think most of the diseases are here only. Okay, still if anything can come outside this, you can just go through your copy, practical copy. Okay, in the practical copy, most of you have written a lot of prescriptions as well as P drug. I think practical copy you should consider to be read once just before exams. Okay, and for the topics, I believe this prescription and P drug can be interchanged and asked anywhere. Okay, so the type of questions you are supposed to encounter in your exams will be like this. Suppose there will be, as you have seen in your third semester, maybe two prescription drug. Next, suppose there is two P drug classification, or even one each also can be given, right? So 10 marks over here, 10 marks plus 10 marks. Okay, then there will be an ADR reaction, ADR form video you have, how to fill the ADR reaction, right? So in the ADR you will be given all the important data about drugs. Don't forget, you all get confused about writing the investigations which are already given over there. Okay, so these things I believe category of 10 marks. Okay, then there will be dose calculation. dose calculation. In the dose calculation, there is a list of doses, for example IV as well as the pediatric dose conversions. Okay, and there is adrenaline in 1:1000, 1:10,000, where can be given, right? Like for 1:1000, okay, suppose there is IM, and 1:10,000 is IV, intraosseous and endotracheal. Okay, in the diluted form we give directly. Okay, this may be subcutaneous also IM. So you should know about adrenaline in detail. Then you can see the previous videos for exams, the playlist SNMCH. Okay, the previous videos you can go through for dose calculation, and yeah, there is a separate video for IV drugs. Alright, then the spotters. The spotters, 10 spotters of 0.5 marks, maybe there will be 5 marks. Right, now there comes the drug interaction. Drug interaction would be a different table. Okay, maybe 2 or 4 drugs can be asked. What are the drug interaction? Okay, so this might be not there in the question paper, or it may be in the question paper, but the main thing important is how the drug interaction you are going to speak. So you have to speak over, and you don't have to write anything. Okay, but you have to make a slot where you are getting the marks. So say, suppose this drug interaction is about 10 marks, right? The 7 is ORS. Okay, again ORS in detail you will be asked about ORS. Okay, the WHO ORS, all this types of ORS, homemade solution, as well as super ORS. Okay, and who discovered? Dilip Mahalanobis. Who is father of pharmacology? Dr. Sir Colonel Ramnath, not Dr. Ramnath Chopra. Obviously he is a doctor, but the full form is who is father of pharmacology is important, है ना? और after that let's go for a different thing, mannequin. Now in this mannequin you will be given 2 sets, basically the IV set and IM set. Okay, so here you have to know the angles, as well as you should know how to give injection, plus there will be one inhaler, and you have to know about how to use an inhaler to a patient, how to use inhaler to patient, you can be asked. Okay, so in this IV and IM model, it may be shown before exam, but you should, in the basic knowledge, you should know how to give a, like in the jet track technique for IM, for the IV you should know where, like how to draw blood and then you give it, right? Even in IM also we withdraw first to check whether it is not IV, and intradermal subcutaneous you don't have to practice, but IV and IM you can practice on your own. Okay, again a mannequin 5 marks. Okay, now there is a logbook viva. In which whatever you have done in the logbook will be asked. Okay, किस तरह से? So suppose you have written your logbook, okay, and all the topics are written over there. Okay, any topic which you have not written, or you have written it wrong, can be evaluated for your 5 marks. Okay, so this is the logbook viva, and then comes the final cal, again 10 marks. In the cal there will be rabbit eye, there will be rabbit eye, there will be like the important graphs for viva. Okay, and there will be like difference between, like suppose there is difference between efficacy and potency graph, है ना. Suppose there is difference between synergism and even potentiation. How can you differentiate between the graphs, right? Suppose even antagonism, in the antagonism, right? Then desensitization. These kind of graphs can be also asked, as was asked in your second semester, right? Now graphs viva, you can be asked about all the graphs which we have discussed. Okay, for example, a nicotinic action of acetylcholine, suppose vasomotor reversal of Dale, vasomotor re-reversal of Dale. Okay, then adrenaline action, right? How the adrenaline works, noradrenaline works, isoprenaline works, acetylcholine works. Okay, so in your dog BP experiment, this can be asked in your exam. The rabbit eye, again, the 4 drugs I believe you should know. In the rabbit eye, number 1, role of ephedrine, lignocaine. Okay, then epinephrine, and 4th is physostigmine. What are the roles of, so you have to write all the points. You have to write whether it constricts or it dilates. Okay, what is the effect on the pupillary reflex, what are the effect on the touch sensation, right? You have to write in the table form. You have to write, suppose you have to make a table, or you have to write the normal eye में क्या होता है, and then we have to write what happens when the test drug is given. So this is all about cal. Okay, you have to know. You can be also asked कि suppose I sit with a laptop. Okay, there is a cal software. Okay, and there are drugs over here, and I ask you, okay, suppose I give this drug. Okay, then show me how the drug is used, how the particular agent or the drug is used. Okay, so this can be asked, and I'm telling you, everything will be recorded during your exams. So please don't get shy of camera, right? So everything will be recorded. So I think this is all about your 80 marks. So in theory, again, there are a lot of topics, but I believe don't come for exam if you don't have like go through all these important topics, right? So again, for in general pharmacology and ANS, anortocoids will be especially asked in viva. And if suppose you go for honors marks, CVS and CNS, you master any one of them or master both of them, because a lot of question will be asked about in CVS, and CVS is easy, CNS is a bit tough. Okay, so make sure what you speak in front of your examiner. Again, what you speak, that will be asked. Suppose if you are willingly telling lot of about GIT, okay, you are whatever drug we are asking, and you are completely saying that, okay, like sir, this is used in peptic ulcer gas. So we'll see that, okay, maybe he has or she has like read GIT a lot. So we will ask, and then you will go through the all about all the emetics. Okay, and we can go for classification of peptic ulcer, the regimen. Okay, so whatever you speak will be asked in your exam, right? So speak carefully, speak very carefully. Okay, So I believe this is all about what I want to say. Again, anti-cancer and chemotherapy you can go through. I will be making small more videos. I think it will be very precise. It may help in revision. So let's see, whatever I can make, I'll make. I don't want to take your time. So all the best.